Recently relaunched, the Thuthuzela Care Centre was launched in 2008 but closed due to inadequate space. Now relaunched and ready to assist gender-based violence victims. It provides pre-trial support including psychosocial, medical and legal assistance.
At the centre we provide medical examination. Let's say for instance you are a victim of sexual offences, you will be examined at the centre. You don't have to go to the hospital and the ward. We also provide legal services, like as I've already indicated that I am the case manager. When the case emanates from the Thuthuzela Care Centre, I go through the docket from the TCC, because we also call the police. They come to the victim at the TCC. The victim does not have to go to the police station. And further, we provide psychosocial services together with our partners, Department of Social Development. We provide counseling for the victims. Everything happens at the TCC. And when the case leaves the TCC, I make sure that it is trial ready, as we endeavor to make sure that we secure convictions in most of our sexual offences cases and gender-based violence cases.
An now-spread community-based organization rendering services to survivors of rape, sexual assault and domestic violence, the Greater Rape Intervention Program is concerned about the number of victims who open cases against their perpetrators.
So this year at GRIP has been quite a tough year. There are days where we've seen up to 10 GBV cases across our network we've got 19 care rooms, which are situated across Mpumalanga. We've seen over 1,700 cases already this year. Specifically at police stations, we've assisted 1,546 people with frontline response services in the police stations themselves. And what is really concerning for me at GRIP is that only 22% of these victims that we've seen at the police stations have actually opened a formal police case. So only 341 people actually decided to open a police case. And the rest of them have received services from GRIP, psychosocial support, or they've gone to one of our shelters, they've seen our first responders, we may have assisted them with a protection order, but only 22% actually decided to go the legal way and open a formal case.
A Human Science Research Council study has found that more than 7.8 million women in South Africa have experienced physical or sexual violence at some point in their lives.
I'm very much happy about the centre, Thuthuzela Care Centre, because both gender, they can be accommodated there, because some of the victims, they are at home, they just fail to get help. Then if Gunale Centre, they can go there and get help.
I think now it will be easy for us to get help instead of going to the police station, because I believe the people we will find there will be trained, unlike at the police station. Because at the police station, police only know how to protect the community, but when it comes to GBV cases, they don't know much. The Commission for Gender Equality vowed to continue to hold the National Prosecuting Authority and SABC accountable.
We are here as a Chapter 9 institution to ensure that we are rolling out all the national strategic plans with regards to gender equality. And you know what, as a Chapter 9 institution, it is our duty to make sure that we keep every single individual accountable, as mentioned, from the likes of the NPA itself to SABC. So anything concerning gender-related issues or any GBV cases, that's what our clearest focus is as well. So the nice thing about this is that we started with the NPA as well and other stakeholders in the year 2022. From there we sat down after gathering them, because we want to find out if everything is supposed to happen accordingly, because we don't want people to feel that the system is failing them. So what we do, we make the necessary follow-ups, we make the necessary research and investigations and also hearings.
Next week, Monday, is the International Day of No Violence Against Women. SABC News, Mpumalanga.